Okay, this is Alexandra Schilling. I'm going to be performing the Trach Care video. So I would get 2 patient identifiers, explain the procedure, assess for pain and allergies, give them privacy. I've got all of my supplies right here, and then perform hand hygiene. Before I would auscultate their lung sounds, and then the bed, put at a appropriate level, put them in semi-Fowler's position, and drop the side rope. So I'm going to put a drape over them. And then I would turn oxygen to 100%, and I'm going to attach an ambu bag that we'll pretend is over here, and then turn sectioning on to 100 to 120, and then this is going to be my sectioning. So I'll place that right here. And I'm going to open the bottle of sterile saline, and then open my kit. I don't have a lot of room, so I do have to do my sterile gloves right here, but normally I would do them on a separate area. And away from the sterile field. Keep my thumb up the whole time. Wow, that was really bad. I'm going to redo this one so I can show it. Okay. Thumbs up. My gosh. Okay. Done. I think because these gloves have been used so many times. There we go. Okay, so then I can take this out. So right there. Touch the top of the gloves, so these are still sterile. Then wrap this around. I'm going to remove the oxygen collar, and then I'm going to pour the sterile saline in, and then I'm going to attach the tubing, and then check the tubing, or I mean the sectioning. Okay, sectioning is good. So begin. I've hit the carina, so then I pull back 1 inch and begin sectioning with my non-sterile hand on the valve. Okay, and then pull out, and then grab the ambu bag and do 2 breaths. And then go back. And then I would rinse the sectioning. And if I needed to do more, this is at the time I would do it, but I do not need to do more. So, do this, remove these. Okay, I'm going to perform hand hygiene. Here's their oxygen collar, and I'm putting hand hygiene in. And then auscultate the breath sounds again, and assess the pulse ox throughout the procedure. And then now we're moving on to Trach Care. So I've got all of that here to perform hand hygiene, prepare my supplies, open the Trach Care kit, and I have a sterile cannula already in there. So I'm going to open the bottle of saline already and put that right there. And then I'm going to remove the oxygen collar, perform hand hygiene again, and on my sterile gloves. So get my supplies ready while I have 2 hands. Okay, and then I'm going to remove the old tracheostomy and replace it with a new tracheostomy with my sterile hand. Then I'm going to pour in some saline, and his oxygen collar is removed already. I believe I said that. So then we would remove the old one, clean that, clean that, clean that, remove it, and then I would dry it without overlapping. And then I'm going to apply a new dressing. Okay. Alright, so he's got a new dressing on, and then I would, to put a new, what is it? The strings. I would take that on one side, flip it around to the other one, tie that one on, and then remove the old one. And then replace the oxygen collar. And then remove my gloves. Hand hygiene. Side rail. Bed is up, brakes are on. And then here's the call light. The end.